Welcome to Unit 1, Section 2, Client Information and Treatment Planning. We're going to break this section down into two short lectures. Firstly, looking at factors that will affect injury recovery and repair. Secondly, subjective information that will influence treatment planning, and when to refer and defer your client. You will have covered some of this information in your Level 3, but now is a good time to recap and add to your knowledge. In this lecture, we will look at the factors affecting injury, recovery and repair. Let's start by defining an injury. This is harm that has occurred to a part of the body and is a specific condition with a specific pathology. Whereas a dysfunction is not easily identified and can be described as a non-pathological impairment or abnormality in the soft tissue function. It could lead to injury if left unchecked. There are various factors that will affect the likelihood of an injury or dysfunction occurring and work both positively and negatively. These include age, gender, body composition, anatomy, lifestyle, diet, activity levels, sporting participation, rest levels, and previous injuries. Let's talk through these and see how they can impact us. Clearly some are very obvious, others possibly less so. Some we can have an impact on, even if it's a change in later life, others we can't. Age is one we can't change. We will without fail get older. This will lead to potentially thinner bones, which will possibly be unable to withstand forces, so will leave us open to fractures. Connective tissue will become less elastic, reducing the ability to passively stabilise, allowing unwanted and uncontrolled movement. The neuromuscular system will be affected with the reduction in fast-twitch muscle fibres, reducing our ability for explosive movement and quick reactions. Age can lead to reduced activity levels, which in turn will increase the risk of thinner bones and so on. None of these things can be fully prevented, but they can be massively reduced with the appropriate levels of exercise, appropriate nutrition, weight management, and so on. Age itself isn't necessarily a problem, it's the other factors that go with it. I know and treat some very healthy 80-plus-year-olds. Gender is next. There is little research in the area of gender making a difference to injury. The research quoted in the manual is pretty old now. More modern research still follows a similar line, suggesting women are more prone to injury than men. There are several reasons for this. Hormone differences, including the reduction of estrogen in menopause, causing bone density issues. Women having a greater Q angle than men. This will impact the knees heavily, leading to more women than men having knee replacements. Women have less muscle mass. More laxity in joints. Women tend to be naturally more lax than men, but also childbirth and breastfeeding will increase this. Women also move differently to men. One thing that can be quite common in female athletes, and we should be very vigilant of, is the female triad. This is 3 medical conditions being low energy, irregular or loss of menstrual periods, and low bone density. This is often caused by not consuming enough calories and generally overtraining as well. This will leave the person open to stress fractures, which are often extremely slow to heal in this instance. Body composition can affect your chance of injury, anything from bone density to fat to muscle ratio. We also include here muscle imbalances. Remember back to your Level 3 anatomy and physiology, where we talked about muscles working in pairs. If one of the side of the pairs is overtrained compared to the opposite, is likely to lead to trouble. Another interesting issue is too much body mass, whether this is fat or muscle mass. When someone is too big for their frame, their body will struggle, range of movement will be compromised. More importantly, the natural position of joints will be altered. Have you ever watched a big bodybuilder move? They struggle to walk properly because there is too much mass in their legs. This would affect the angle of the hip joint, potentially causing more joint wear. Again, the same with the shoulders. Often the arms don't sit close to the body, putting more pressure on the shoulder joint. The excess weight in both an obese person and a big bodybuilder needs to be considered when thinking about the excess strain on weight-bearing joints like the hips, knees and ankles. Anatomy is one we can't change, but again we can have an impact. We are all built differently with different strengths and weaknesses. Working with our strengths will help. Lifestyle. This can be how active you are, what hobbies you have, how much repetition there is in those activities and hobbies. Diet. Obviously, the better the diet, the better the body will function, the better the body composition. And if there is any injuries, the quicker and better they will repair. This one does have a big impact on healing. When people don't consume sufficient or suitable calories, their healing time can be massively increased. I have seen a stress fracture take a year to heal sufficiently to be functional due to long-term calorie deficit. Sports participation is good, but can have its drawbacks by leading to extrinsic injuries. But the activity is good for you. Rest levels are just as important as activity, and you need a healthy balance between the two. Not enough rest and the body won't have time to get over and grow from the activity and allow you a chance to recharge your batteries. In relation to an injury, rest is very important, especially at the beginning. Previous injury may leave you open to further injury elsewhere or in the same location. The better the rehab has been, the better the area will be in the future. Many of these factors are interlinked, which is why injuries are often down to more than one cause, unless it's something like a bad tackle. Poor diet may lead to poor bone density, less muscle mass, possibly more fat mass, less energy leading to low activity levels, which would then lead to a reduction in muscle mass, and so it goes around. This doesn't mean someone will have an injury, but every positive or negative will tip the scales one way or the other. These factors will also positively or negatively affect recovery and repair, and again it will be likely a combination rather than individual elements. There will be many more factors than those listed, for example medication, so this is why it's important to get a good basic generalised subjective history before you get a subjective history of the issue. The information will go a long way towards helping you understand the needs of your client as well as the needs of the present condition they have come with. It will inform your treatment plan and rehab plan. Now you have completed this section, you can complete the quiz and move on to the subjective history that will influence the treatment plan.